AI has been used in medical billing for years, but up until now, only by private insurance companies. That will change in 2026. The Trump administration is launching a private program next year incorporating AI into Medicare billing. The goal is to see how much the government could save by using AI for prior authorizations.
This is an important topic, and our medical expert, Dr. Paul Coley, is here to break it all down for us. Because for viewers who are not familiar, for us that are not familiar, what is a prior authorization? Can you speak to that and how that process even works?
So if you go to the doctor's office, you get an expensive medical test procedure, an MRI, a medication, a scan, or surgery. The doctor has to apply for approval to the insurance company. And if the insurance company says no, you're out of luck. And you can imagine that procedure can be very time-consuming. It can delay your care, and it requires hours and hours of work from the doctor's office in order to actually submit all of the supporting documentation to get it approved.
So is that kind of like the reasons why the Trump administration is focusing on this? Why now?
Yeah, because of violence in the streets. So I want us to all think back to December of last year. Do you remember what happened then? The CEO of United Healthcare.
Right.
So Dr. Oz has come up very strongly and says it's the violence in the streets, which is really sort of talking about the prior authorization process in the private sector, but even in Medicare is the reason they're thinking about it now. And he also says that he wants to try to save Medicare dollars, make sure that the system is not being abused or fraudulent.
So what's the controversy then?
Well, so it sounds like a good idea, right? Why not? I mean, AI has kind of penetrated every aspect of our lives. Why don't we have AI write the prior authorization, submit it to the insurance company? But if a human being is not looking on the other end, the AI algorithm, which many think is designed to reject everything that's high cost, rejects the services, starts to question the doctor's decision-making, and patients are sort of left fighting for their own care. So it's really controversial in medicine because a lot of private companies have already launched this, and 61% of physicians feel that there has been an increase in denials since this came through. Now, the insurance companies are saying, no, that's not the case. Our doctors always look at it. But that's certainly the concern is, could this be abused?
Okay, so you just spoke to not only are you concerned for the patients, but, prior, the physicians have had, they have their concerns, rightfully so. Has there been any pushback? Is there anything that physicians have tried to voice to say that this is not currently working?
We try. We really, really try. But what happens in a busy doctor's office where you have thousands of patients, you're trying to submit for approval for all these, you'll try once, maybe you'll appeal. If AI keeps denying you, you're going to say, I'm sorry, you can't have your MRI, you can't have your cath, you can't have your surgery. Now, again, the administration is saying they're trying to save the system money because there are physicians out there who are doing knee scopes, and this is one of the procedures that they've actually put in this algorithm is knee scopes because they're quick, they make a lot of money, and they're easy to do. They're trying to save the healthcare system money. But when you start getting to the point where the doctor has to jump through all these hoops to get care, it basically interferes with care, it delays diagnosis. And a lot of times the patient gets worse. So think about like a scan, for example, for cancer. And if you're trying and trying and trying, it can take weeks or months to get it approved. That patient is potentially getting worse, and then it may impact their treatment and their prognosis.
That's alarming.
Yeah, well, and it also sounds like this could just be the beginning, right? AI is kind of taken over everywhere. If this is just the start, where else could AI, enter in the industry?
Everything. I mean, we already have AI reading our scans, our x-rays, our echoes. We have AI making medical decision making. I use AI in my clinic to scribe for me, to write all the notes in the office. Now, then you start talking about privacy concerns when that happens.
Yeah, I'm sorry, how does that work? So it listens and then it's right, okay.
It listens the whole time, and then as soon as I walk out of the room, the note is already written.
Oh, wow.
And it's transcribed everything better than I could ever do it. But who owns that information, and what is it doing with that patient's private information? So we do consent our patients to allow the use of AI. And in fact, if you ask patients, they get the exact same care, but you tell them, oh, I used AI during this visit, it actually decreases their satisfaction. And then when it comes to these billing issues, the concern is, what is the algorithm? Is there transparency? Is there regulation? Is this a way for insurance companies to, as they said, deny and delay? Deny and delay. That's the motto of insurance companies for doctors. Is that what the abuse is going to happen? So there's a lot of questions, certainly a lot of exciting applications, but I worry that something like this, where billing automatically denies, could be problematic.
I guess we have to wait and see, right?
Well, they've looked at the data in Cigna. What is the average amount of time a doctor spends reviewing a prior authorization? 1 second.
Second?
Really?
1 second. So basically, the AI kind of makes the decision, and even though a human being is looking at it, they're not really looking at it. So I really, really hope that this pilot, which by the way is not going to be in our state, it's only in a selected number of states, it's going to be a 5-year pilot. I hope that it gives us some information about which way to go.
Interesting.
Yeah.
Dr. Coley, thank you.